My body is shaking.
My fingers are numb.
Welcome to Hot Docs, the show with hot questions and even hotter doctors. I'm Zay Edgren, an M3 at Iowa Carver College of Medicine, here with Audun Saterbak, an ultra marathoner, avid sports watching enthusiast, and second-year pathology resident. Welcome, Audun.
Good to be here.
Awesome to have you. First question, how are you with spicy food?
So I do okay with spicy food. I've never been known to be great, but that's part of the fun.
Awesome. So for those unacquainted, what we'll do is we'll have a spicy wing, we'll do a spicy question, and then as time goes on, the questions may get spicier. All right. Are you ready for the first wing?
I think so.
Okay, this is with bulldog hot sauce.
Quite good.
I can tell. I'm gonna hurt later. These are big wings too.
That's kind of a slow burn. Sheesh. We could be in trouble.
Beer, brats, and cheese. So these are three elements of Wisconsin cuisine. Which one is your favorite, and what recommendations do you have?
So I'm gonna get a lot of flack for this, but I am actually one of the few people from Wisconsin that doesn't drink. So I would personally put that last.
Okay.
I think cheese has got to be number one. There's so many different things you can do for it. I'm going to give a shout out to my hometown Westby Co-op Creamery as the hidden gem, and they make some of the most phenomenal cheese curds and cheese. So it's a small town just outside of La Crosse, Wisconsin, and I would highly recommend checking it out if you're interested.
And what else is special about your home state or hometown?
Home state, you gotta love the Badgers. I know it's a controversial opinion here in Iowa, but hands down the best Big Ten college. Best experience in terms of sports, and the campus is just phenomenal with two giant lakes. And as far as La Crosse, Wisconsin, I mean, it's just a beautiful small city. It's kind of about the size of Iowa City, which is kind of what drew me here as well in the first place. Mango habanero is about where I stop at Buffalo Wild Wings, so we'll see where this takes us.
That's one of my favorites there too. Audun, a coworker of yours is quoted as saying, "This man thrives on pain. Those wings don't stand a chance." This past April, you even ran a 100-kilometer race across the Cascade Mountains. And as everyone in the Department of Pathology knows, you run to work every single morning. So what started your passion for running?
I started running cross country way back in middle school, and I didn't really enjoy it much. In fact, I was quite the sandbagger, and I was always running towards the back of the pack. And then sometime towards high school, you sort of just meet a group of friends, and you have a really great time doing an activity, and it sort of makes that activity more fun, and you have great coaches who are really inspirational, and they sort of out there leading by example. And I had a coach in my high school cross country team who was a big ultra marathon runner, and so I always sort of looked up to him and wanted to sort of accomplish the things that he was able to someday. And he, while I was in high school, was doing these crazy 100-mile ultra marathons, and he would always come back and tell us the stories, and it just always seemed like such a cool experience.
Yeah, that's awesome. My lips started burning so hot while you were talking. So it sounds like a lot of it was the friends along the way, and it's blossomed into something else too.
Yeah, friends, coaches, and just sort of getting you a really solid foundation and an interest in something that you want to carry through, even when you sort of graduate past that or leave that sort of environment.
Yeah, definitely. Back to the race that you did in the Cascade Mountains, what was that event like?
So that was the longest race I've personally done, and as I'm sure a lot of the medically oriented people out there can tell you, that you don't necessarily have a lot of time to train. So it was kind of like going into this thing knowing that you're a little bit undertrained, but still wanting to do it just for the experience to sort of test yourself and see if you're, what you're able to do. Mm-hmm. So it was out in Oregon, and it was weather was perfect for it. And it was this 100-mile race sort of through rolling hills and a little bit of the mountains of the Cascades around the Columbia River Gorge. But it was quite rugged and quite wild, and I think I've told a lot of people that at mile number 7 of 63, they have this big waterfall basin, and shocker, the bridge is out, and you can see pieces of the bridge strewn down the basin, and you got these people knee deep in the waterfall basin, trying to hoof it through, and then you got wet shoes, wet clothes, and you're all right, 55 miles to go.
Oh my God.
It's a good metaphor for residency. Residency in a day.
Oh, fuck.
honestly, this one's actually not that bad. It looks red, but
It tastes like it would be really bad, but then it's not.
right.
Not that spicy.
Maybe it'll build on us.
So,
Oh, it burns. It builds.
yeah,
There it is.
like the back of the tongue a little bit.
There it is.
So speaking of pain, with your history of being such an intense runner and thriving on pain,
That's dangerous.
people might expect you to be working in the emergency room or in the ICU, for example. But what drew you to pathology? And did you consider any other specialties?
Yeah, so my journey into medicine was sort of inspired by my father, who was an orthopedic trauma surgeon. You got the hiccups.
I get the hiccups every time I eat spicy food.
Yeah, this one's, it builds. I take it back. So he was an orthopedic trauma surgeon. So initially through the first 2 years, that's kind of what I thought I was going to end up doing, was to be a big surgeon. And quite honestly, I did love my surgery rotation. And then sort of at the start of third year, just before applying, or sort of towards the end of second, I did a pathology rotation. And I found it just as intellectually stimulating. I love the diagnostic aspect of it and just being able to be very visual and looking at things and giving those diagnoses to patients. And it just also covered such a broad range of scope. Because you do like the tissue side and you have all this clinical lab micro stuff, and it's just really fun to sort of jump from a bunch of different things. So I did that rotation. I sort of liked them each both equally, and decided that for me the tiebreaker was having a specialty that would allow me to do the sort of things outside of work that I still really enjoy, not having to make those sacrifices.
I'm going to be honest, it was hard to understand a lot of what you were saying. I'm crying.
Brad say.
I'd take a piece of bread.
The old bread trick.
Audun, you need bread?
Cool.
I'm going to tough it out. I think I'm going to take this as far as I can before I break down here.
And for those not aware, pathology can be one where you can be more flexible with your hours, so you can be less intense and do hobbies like, running
Right.
dozens and dozens of miles.
Which was something I guess I wasn't ready to give up, to do the 6-day work weeks and the 24-hour calls and all the stuff that you find with more intense specialties.
You've previously said that GI and hepatobiliary pathology are some of your specific interests within pathology.
Yeah.
So for those who aren't very well acquainted with pathology and don't know as much about it, how would you explain your interest to them?
Yeah, so I think GI is just one of those special fields where it covers such a broad range of things, because you're looking at not only the esophagus, the small intestine, the colon, you're looking at all the organs along the way. It's the liver, it's the pancreas, it's sometimes even the spleen, and you get to see just a very wide range of not only tumors, but resections for benign reasons, biopsies, and it's a very high volume specialty, which works really well in both an academic or a community setting. So it just kind of opens up a lot of doors.
Mm-hmm. So what's next after completing your eventual goal of running a 100-mile race as opposed to a 100-kilometer? And what advice do you have for people trying to balance their hobbies with something busy like residency or med school?
Yeah, as for what's next, 100 is kind of the pinnacle of my scope of thought so far, and I guess I haven't really thought past that. But in the scope of ultramarathon running, you hear all the time of these fun races, and they sort of take ultramarathon running, but not to a set distance, and they do timed runs, like how far can you run in 8 hours on a track or something crazy like that, for people that love suffering. Or you have these last man standing races, which I've heard a little bit about, where it's sort of like you do a looped course, and you basically just run the same loop until everyone drops out. And I think that would be sort of a fun experience to maybe, after I hit my goal, to branch out to some of those more unique and exotic races for a different experience.
And as far as how you balance the hobbies with, being a busy resident?
Right. So I think one of the things that I've found out is, and like you've talked about before, people know me for running to work. And I think, when you are a resident, you're very busy. It's a very high-stress job. And you get to the end of the day, and sometimes for most people, the last thing people want to do is exercise or go do these hobbies. So I've sort of found a way to incorporate that, like you said, in my commute. So picking places to live that are close enough where it's within a certain distance to make the run manageable, but still challenging, where I'm maintaining a good level of base mileage. And for me, because at Iowa we have bad parking situation, it takes roughly the same time to run to work from my house 2.5 miles away as it would to drive to the parking lot and then walk in or run in from the parking lot or take the shuttle. So it's sort of like just finding a way to make your time as efficient as possible. For me, that's kind of how I do that.
This is where training pathologists have to measure, describe, and prepare organs and surgery specimens for the microscope. And this can be quite intense at times. So tell us about your most grueling experience in the gross room.
I mean, there's two different answers to that question. I think the most grueling is when you're first starting and you don't know anything. So a specimen that should take you 2 hours is taking you an entire day, and you're literally sitting there over this cancer resection.
Can I get that bread? Go ahead.
For hours, and you stare at it and you're like, what do I do with this? So I think part of the grueling part is not knowing. My salivary glands are just like kicking.
Will's not doing so hot.
So most grueling was probably the first specimen I ever did, which was like this cystoprostatectomy, which is a bladder and prostate resection. And I had no idea what I was doing, and I probably messed up that specimen in about 4 ways. And I mean, that's bad. I mean, the other days in the gross room that are just grueling is like shit. I can barely talk. The call days, and it's gotten so bad because the volume's so high that you sit there for 16-hour days cutting up skin biopsies. And as any of the externs can tell you, that's pretty grueling.
Yeah.
All right, I'm breaking my.
The milk comes out.
I'm breaking my hardcore attitude here.
Oh my god.
I'm literally shaking.
Can I get you guys anything else? Like, I can run the other fridges. There's like whipped cream.
My body is shaking.
It's full blown serious,
You
man.
guys eat so much.
That's a slow build. Oh my gosh.
Oh, there's more milk for you.
Yeah, I'm lightheaded.
Jeez. Some more bread.
You could soak it in milk.
Oh, that's a great idea.
I don't know if I can swallow this. I don't know if I can swallow that.
I feel it. My fingers are numb.
You gotta distract me. What else we got here?
Pathology is often called the hidden gem of medicine. What do you think people should know about it? What advice do you have for students considering pathology?
Yeah, I think as far as the hidden gem goes, it really is, because not a lot of people get any core experience with it in their time through medical school. It's mostly through the lens of internal medicine, where they're trying to call the pathologist and see what's going on with my patient, but they never actually get to be hands-on. My advice for people is that they should go experience and at least try to do an elective rotation and seek that experience out, because otherwise, you never know if it's something that you would be interested in. What was the other part of the question?
Oh,
I can't even think.
yeah, I think you got the hidden gem. What should people know about it, and what advice for people considering it? So, I think that was all of it. So,
what should people know? That it's a very lifestyle-oriented specialty, and you can find a job with really good work hours, working Monday through Friday and taking home call. And residency, even though the times when you are working and you're in surgical pathology, you will work a lot of hours during those days. So it's not like it's this, golden pasture that you're going through in pathology. Like, it is still very grueling work. That you do have more of those free times, and you get a golden weekend most weekends, unless you're taking home call, which is like they ordered 3 platelets. What do we do? And you call them back. But I think it's something everyone should consider. And especially if they go through medical school and they haven't found something they really love. There's a lot of different things within pathology that most people could probably find something to enjoy.
Pathology, I agree. It really was like a friend waiting for me when I realized I didn't like core year. So I definitely agree with all of that. Anything you want to advertise, anything you want to throw out there, last words for students or residents or anyone who might be watching.
Thank you guys for having me here. I think the important things I would emphasize are sort of from the last question. Just give pathology a chance, because it's something you won't necessarily be exposed to in your day-to-day education. And just sort of know what we are and what we do, and that it's a pretty broad specialty, and that there's probably something for everybody. And try running, because running is pretty fun.
Well, thank you so much. Do you want to eat some normal wings now?
That sounds great.
What's more painful, this or 100 miles? Will asked.
What's more painful? This has probably a higher peak, pain. After a while, and you're running an ultramarathon, it sort of plateaus, and this just kept coming. It was pretty unrelentless. If you ask me what I would rather do, give me the ultramarathon.
Heck yeah. I love that. Oh God, I'm touching my face. That's great.